of the El Paso County Public Health Board of Health into order. We'll start off with a board member roll call. To my left, we have our Vice President, Doris Ralston.
Here.
Commissioner Cammie Bremer.
Here.
Dr. Chan. I think she's absent today, or is she online? It says absent. Okay, and I know General Jack Briggs informed us that he won't be able to make it. He's at a meeting out of town. Thought he could get online, but that just didn't work out logistically. So we'll go on to Councilmember Dave Donaldson.
Here.
Commissioner Lojinos Gonzalez.
Here.
And Mayor Glant? Now I messed up the first name. Havner.
Here.
Okay, and Dr. Richard Vu hopefully will be coming in shortly, and I'm Ted Colas, and I'm present also. Hopefully you've had an opportunity to look at the agenda. We need a motion to approve the agenda.
So moved.
Second.
Thank you, Doris, and Commissioner Gonzalez. All in favor of approving the agenda as it is presented, let it be known by saying aye.
Aye.
Aye. And any opposed? Of course, there is none. Moving on to Board of Health comments. I'll start to my left with Councilmember Donaldson. Any comments for us?
No comments this morning.
Okay, and Mayor Havner
No, sir.
and Doris.
I would just like to remark that the safe injection site bill was failed, tabled, so I was really happy about that.
Great, thank you. Commissioner Gonzalez?
Nothing this month, thank you.
Okay, and Commissioner Bremer? All right. I think the only thing that I would bring forward is that this is, April is, was it Public Health Month? Public Health Week. Earlier this month, I think it was April 1st through the 5th was Public Health Week, and we want to publicly acknowledge that. Thank you all for all of the work that you do. We certainly appreciate it. We'll go on to the approval of the minutes. We need a motion and a second to approve the minutes from our last meeting.
So moved.
Thank you, Doris.
Second.
And Commissioner Bremer. All in favor of approving the minutes as they were presented to us, let it be known by saying aye.
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 Aye. Any opposed? And again, there is none. Public comment, we don't have any public comment for any items not on the agenda. And we're going to move to, we've got a couple of proclamations that are going to be read to us this morning. The first proclamation is for recognizing the 30th year of Kid Power. And I believe that Commissioner Bremer is going to read this proclamation to us.
Yes, thank you, Mr. Chair. Were we going to do public comment first?
Did we do, we said we had no public comment?
Okay.
Oh, okay. I see what you're saying. So some folks from Kid Power wanted to come up and speak first before we read the proclamation.
Mr. Chair, I was speaking of item number 5. Okay,
I addressed it.
I apologize. So we had none.
Yeah. All right. So we can bring the Kid Power folks forward.
Good morning, Kid Power representatives. I do want to do an introduction to who we have here, and then Jan Isaacs-Hensry is the Executive Director for Kid Power, and it is so wonderful to see you here today. It's been a while, and you know I'm a big fan of Kid Power, and one of my daughters went to Kid Power, so it's just so lovely to see you here. And I know that we have a few other members, and so Jeanette Graham, who is the Vice President, Board of Directors for Kid Power. We also have Diane Lawson, who is a Community Relationships Coordinator, Brandon Williams, Program and Creative Coordinator, and Angela Hamilton, who is the Program Director. And again, so happy that you are here with us, and if you'd like to make some comments, and then Commissioner Bremer can go into reading the proclamation.
We
are so honored by this proclamation today, and we thank you. As Kid Power celebrates 30 years in our community, and as together we recognize that this is Child Abuse Prevention Month, we are well aware that we would not be here without the significant support of our extraordinary community. We are here because many dedicated people prioritize the well-being of children, and there is nothing more important to our future than the safety of our children. While child abuse is a heartbreaking reality, Kid Power represents hope. We can and do teach effective, simple skills to kids, their caregivers, their school professionals, to help keep them safe and healthy. The El Paso County Board of Health and the Health Department itself are all about prevention, and we appreciate your partnership and commitment to an upstream approach to health and safety. Together we make a difference, and we thank you so much.
Do we have a video
We do.
to share?
Stop on too. Stop, I don't like it.
This is about my safety.
If something's bothering you, you don't have to keep it a secret. No! I need help!
I want to make sure that my kids have the tools they need when I'm not there with them. And Kid Power does that.
Kid Power taught them about how to be safe without it being scary.
What I liked about Kid Power is that I learned not only preventative measures, but also how to react in certain situations.
I've learned how to defend myself if something does happen. I've learned how to be safe online, how to use my voice if I don't like something.
Use your words, use your body, use yourself.
Gosh, I mean, what better could you ask for, right? You know, as you send your kiddo off into the world.
Kid Power is a nonprofit organization that teaches kids, teens, and adults personal safety and confidence building skills.
This is about my safety.
We call it people safety because really what it's about is teaching young people to be safe with and around other people.
We'll talk about this so you can feel safe at school.
We are part of an international organization started by Irene von der Zonde in 1989. And our center, Colorado, started in 1994. And since that time, we've trained tens of thousands of kids to be safe. The mission of Kid Power is to teach kids skills to reduce their risk of abduction, assault, physical, emotional, and sexual abuse, and also bullying. So we are trauma sensitive and trauma informed. We're developmentally appropriate, and we're fun. In Kid Power classes, students learn how to walk and move and be in the world with awareness, calm, and confidence.
I said stop.
And they learn how to use their voices and their bodies to stay safe.
No! I need help!
They learn how to recognize what's okay and what's not okay. They learn how to set good, clear boundaries, both with people they don't know and people they do know.
Stop or I'll report you.
We've done classes for individuals of all levels and abilities, people with physical challenges. They come out of class with a sense that they have the ability to keep themselves safe in the world.
It's indescribable almost. I mean, the way that you see them come into their bodies, the way you see them feel strength in their voice, trusting their gut.
I feel different because I know how to use my voice in the right way. And I know that if something were to happen, I just use those skills because I never forget those skills. They're always just in a place in my mind where I can reach for them and they'll be there for me to use.
When you see a student like that find their voice and their power, that is huge because you know that you have given them a skill that's going to help them for the rest of their life and potentially be a life-saving skill.
It just makes the heart feel full.
Kids are the most criminally victimized segment of the population. 1 in 10 kids will be sexually abused by the time they're 18 years old, and 1 in 5 kids will be bullied.
Truth is, abuse can happen in any segment of our community, so no one is immune.
It's essential.
Please stop.
It's critical for us to be able to do whatever we can to help kids be safe, because all kids deserve to be safe.
Kid Power gives them the power themselves to say, my body belongs to me, and I have the power to do something about that.
They learn to trust that intuition of their own bodies, saying that this doesn't feel right and I'm going to say something.
I think he got more out of it than we even know right now.
It gives me some peace, actually, to know that she's prepared.
No, stop. Every kid should learn Kid Power. You need those skills. It's important.
I want to tell them that it's awesome, totally fun, and great.
Brave, empowering, life-changing.
It changes lives, it saves lives, and there is no other way to say it.
It was a wonderful video. Thank you so much. Commissioner Bremer is going to read the proclamation, and then we are also going to recognize Kid Power with a Public Health Champion Award. So if you'd like to go ahead and come up to the podium again, please.
Mr. Chair, I would like to move approval of the following proclamation recognizing Kid Power of Colorado. Whereas, April marks National Child Abuse Prevention Month with the 2024 theme of Building a Hopeful Future Together, focusing on creating a nurturing and supportive environment for children and families across the nation. Whereas, a top priority of the El Paso County Board of Health is to promote opportunities for safe, strong, and healthy community. And whereas, programs that benefit children and families in turn benefit society. And whereas Kid Power of Colorado is an evidence-based program that teaches young people simple, effective skills for being emotionally and physically safe, both with themselves and others. And whereas the mission of Kid Power is to teach young people ages 3 to 18 personal safety and confidence building skills to reduce their risk of abduction, assault, and emotional, physical, and sexual abuse. And whereas this experiential, strengths-based program is designed to reduce bullying, exploitation, and abuse against children, including those with diverse physical, cognitive, developmental, intellectual, and neurological abilities. And whereas Kid Power makes adaptations for how different people's bodies and minds work, focusing on what they can do rather than what they cannot. And whereas Kid Power has trained more than 67,000 individuals in our region. And whereas Kid Power has never turned away a family in financial need by making available financial scholarships and eliminating barriers to allow services to be available to all. And whereas Kid Power has partnered with El Paso County Public Health staff to bring safety trainings to the community and is a partner in addressing child and youth health and well-being. And whereas in 2024, Kid Power marks its 30th anniversary of bringing services to El Paso County communities. And whereas the El Paso County Board of Health wishes to thank Kid Power for its hard work and dedication to keep El Paso County children and youth healthy and safe. Now, therefore, be it resolved that the El Paso County Board of Health recognizes Kid Power of Colorado for its work in preventing child maltreatment and strengthening children and families. Moved this 24th day of April. Should we sign it? It will be signed by President Ted Colas and attested to by Susan Whelan.
Okay, Commissioner Bremer made a motion prior to reading that. Do we have a second?
I'll second it, yeah.
Okay, we've got a couple of seconds from Councilman Donaldson and our Vice President, Doris Ralston. All in favor, well, let's open it up for discussion. Anybody wish to make any comments prior to taking this vote? I think I do. I think the video was awesome. The testimonials that are coming from kids themselves, wrote down a couple that said, every kid needs Kid Power, and it's awesome, totally fun, and great. So, pretty good testimonials from the participants that go through the program. Thank you for what you do, anything that you do to keep even one kid safe from being traumatized by somebody or from improper treatment is a win. And 67,000 contacts in the last 30 years. Thank you very much. Dr. Boo.
Thank you so much. Also, I have a question. It's very sobering for me to hear, and I did not know this. Is it 1 out of 10 kids?
Yes, 1 in 10.
Can you talk a little bit more about that and the reasons and et cetera, and if there's anything you think that might be able to reduce that number?
Reasons are complex, right? I think what we are doing, hopefully, will reduce that number, raising awareness, letting people know about that statistic, and talking about it more than we ever have before. Because when it comes to sexual abuse, that's a taboo topic. And so being able to say it out loud and to be able to acknowledge it is one step in the right direction.
Thank you. You can see even I have difficulty saying it out loud.
Right.
Thank you.
Doris.
I'd just like to say that their program is a stellar example of primary prevention, and to me that's what public health is all about, and so I'm so proud that we have them in our community and the work that they do, and I know it makes a difference.
Thank you so much.
And my youngest is turning 30 this year, and he and his brother both went through Kid Power as youngsters.
Fantastic, fantastic.
Okay, let's call for a vote. All in favor of the proclamation as read, let it be known by saying aye.
Aye.
Aye. Any opposed? And of course, there is none. Passes unanimously. And Susan, you want to make the presentation?
Yes, I just wanted to congratulate Kid Power on 30 years of service, and I think some of the really amazing work that you all do, and very passionate about kids and public health, and we just so appreciate the partnership. And so we would like to give this to you, recognizing your organization and yourself and your leadership for the 2024 Public Health Champion.
Thank you so much.
Okay, and we're going to do a photo?
Oh, great.
Yeah, come on up here.
Behind? Calvin, do you want us here, or do you want us behind the, oh, like this? Have some in front and some in back. So I think you're kind of right behind front and feel free. It's a little easier. And then Board of Health members, we don't mind just kind of squeezing together.
I'm not going to stand behind you because nobody will see me.
Who's getting beat up in that video with the helmet?
Yeah, who's wearing this suit?
I know, right?
Oh. Get out from behind the table. Sorry, I'm having to get your steps in today. Just think that this help you stay safe. Yes, exactly. All right, and settle. There we go. 1, 2, and perfect. Thank you very much. Thank you.
Okay, our second proclamation of the morning is going to be in recognition of National Nurses Week 2024. And I think Summer South is going to read this proclamation to us.
Hello
Good
and
morning.
good morning. My name is Summer South. I am the Clinical Services Division Director, and I'm also a nurse. I'm going to read the proclamation this morning, but before I read it, I would like to invite any of our nurses that are here today
You bet.
to please come up and join me while I read this proclamation. But just before I read the proclamation, I also just wanted to say that not only am I incredibly proud myself to be a nurse and to be serving in this capacity, but the work that nurses do in acute care, in primary prevention, it is really difficult to put into words. And I just feel incredibly honored to be able to represent the face of nurses here at El Paso County Public Health. And I'm actually really happy that I get to read a proclamation because it would be very, very difficult for me to keep this short and sweet. I have a deep passion for nursing, for the work that I do, for the work that they do. So, without further ado, okay. Whereas National Nurses Week is celebrated each year between May 6th, National Nurses Day, and May 12th, the birthday of celebrated nurse Florence Nightingale. And whereas National Nurses Week honors the contributions and sacrifices of nurses and serves as a reminder to thank the medical professionals who keep individuals and communities healthy. And whereas the theme of National Nurses Week 2024 is Nurses Make the Difference. Honoring nurses as extraordinary individuals who display courage, care, dedication, and commitment in caring for others and make a positive impact on everyone's lives. And whereas the American Public Health Association defines public health nursing as the practice of promoting and protecting health of populations using knowledge from nursing, social, and public health sciences. And whereas public health nurses work to promote wellness and help prevent disease and reduce health risks at the population level through evidence-based care and education. And whereas El Paso County Public Health nurses serve individuals and families across numerous programs and services, including nurse-family partnership, immunizations and travel, tuberculosis, disease prevention, reproductive health, maternal child health, and much, much more. And whereas in 2023, El Paso County Public Health nurses provided many critical services, including but not limited to 11,329 immunizations, 1,981 reproductive health visits, 2,685 nurse-family partnership home visits, and care for 43 active and latent tuberculosis cases. And whereas the knowledge and skills of public health nurses enable them to make significant contributions to public health through a unique combination of clinical nursing background with contributions to public health through a unique combination of clinical nursing background with knowledge from public health and social sciences. And whereas it is more important than ever to celebrate nurses across all fields for their unwavering care and dedication for their patients and communities. Now, therefore, be it resolved that El Paso County Board of Health hereby proclaims the week of May 6th through the 12th, 2024 as National Nurses Week in El Paso County, Colorado. Moved, seconded, and adopted by the El Paso County Board of Health at its meeting held April 24th, 2024 in Colorado Springs, Colorado. Do I need to? El Paso County Board of Health by Ted Colas, President, attested by Susan Whelan, Secretary.
Wonderful. Well, thank you very much. I think that Susan's position is secretary to the board, president of El Paso County Board of Health, secretary to the board.
Yes.
Let's get a motion and a second, and then I'll open it up for board comment after that. Do we have a motion?
Motion.
Thank you, Dr. Vu. And a second?
I'll second.
Is that Glenn? Thank you very much. And let's open it up to board comment. I think Dr. Vu had his hand up first.
I have a comment. So I see words like sacrifices, extraordinary, courage, care, dedication, commitment. I think we might have forgotten superpower.
That's on the next one. Thank you.
Any other comments? Well, I do. I think probably the word that I would put in there is compassion. I've personally benefited from nurses, their technical expertise, their medical expertise, but I've also been a direct recipient of compassion from a nurse that was life-changing to me. So thank you all very much for what you do. It does not go overlooked. You have our gratitude, and you've got this proclamation. But imagine how long the line would be if every life that you impacted was here today to say thank you. It would truly be impressive. The parking garage isn't big enough. Thank you so much for all that you do. I know that we'll take a vote here in a moment, and then I think we want to take a photo with you all also, but we're probably going to have to do that back here against the backstop because there's so many of you. So I'm going to open it up for the vote now. All in favor of accepting this proclamation as it was read this morning, let it be known by saying aye.
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 Aye. Any opposed? And of course, there is none. It passes unanimously. Thank you all very much. Oh, yeah, I'm sorry, Susan. Susan wants to talk.
I would like to say just a little bit. I am so impressed by our public health nurses, and they do a variety of different impressive efforts, population-based public health, direct care for unique situations, high-risk, complicated situation, and have the patience, the expertise, the kindness. I could go on, and I wanted just to make the point that you all are serving the most populated county in the state of Colorado. And what you see here is a small but extremely strength-based, mighty team. And I know that we have some nurse-family partnership team members probably that are in the field, because I'm sure that we're missing some. But this is our public health nurses. This is, our team. And I point that out because in a population the size of El Paso County, I think that that's really important to note, because a lot of times when I'm attending meetings, the impression is that we're flush with nurses. We're flush with staffing. And you see that we've got a very strong team here. They are very dedicated, and wanted to acknowledge that, because serving the most populated county with the complex needs and how we're evolving as an organization and as a public health field, I want to note that. And so you are appreciated. And I do want to say that I am extremely grateful that my deputy director is a registered nurse. I think that is the benefit to this agency's leadership. I think that's a benefit to the community. And she's also a master's in public health as well. But I am extremely grateful to Deanne Ryberg that she serves in a leadership role. And I know that I see the difference in working with Deanne, and I'm sure you all do too, and I see your heads shaking up and down. But I do want to note that she's very integral to the success of our agency and our community. So thank you so much. Really appreciate all of you, and the nurses that are not here as well. So please extend that. Thank you so much.
Okay. All right, if we can get you all to come back here and join us, we'll get a photograph.
Are we going that way again?
No, we're going to come this way. Probably going to have to sit down.
All right, public health nurses, come down. Oh, boy, okay. I do not try to
Oh, really?
Good morning. We have Sarah Kinney with us, and she's going to give us our finance and budget update.
Good morning. I'm Sarah Kinney. I support financial services and public health as our budget supervisor. Today, I'm pleased to present our first quarter performance for the agency. So this is our monthly managerial report, which you're very familiar with. I'd like to start first with our revenue. As you know, we have a complex 38 business units that have various grants that support them. And so I'd like to provide a little more insight this month on revenue and some of the complexity there. As you come away from these briefings, I want you to feel empowered with additional information. As we've spoken about before, our El Paso County revenue is about $6.6 million. And so it is trending exactly as we would predict for this time of year. Our state LPHA funding is also trending exactly as we would anticipate for this time of year, as you can see by our budgeted and actuals, leading to no variance. Now, I'd like to take a little bit of time to talk about program-specific grants. In past briefings, Financial Services has explained that there is sometimes a timing issue as to when we get this actual revenue in. But there are also other contributors to reimbursable grants this particular quarter that I'd like to cover so that you have better insight into how complex these items are and the due diligence that we do in financial services to really monitor these program-specific grants very closely throughout the year. So you can see that we're receiving actuals in at $437,107 less than we would anticipate. A large portion of this is due to the timing of those reimbursable grants. So we execute on that work, and then we invoice and receive the money 30 to 45 days later. The other contributors this month is that the CDC infrastructure grant is under executing slightly on operating expenditures from when we had budgeted it. We expect that these expenditures will be made in this calendar year for professional development and training, which will happen just slightly later in the year than I had originally anticipated. On the business unit of impaired driving prevention, we had budgeted about $100K up front. And in looking at this, I think we should budget that money to execute more smoothly over the year. So I'll be making a slight adjustment in April. This is leading to about $82K of that variance that you see in the $437,000. I do anticipate that they will capture grant revenue. In the emergency preparedness business unit, we're underspending a little bit from what was budgeted as compared to how they've executed in past years. But I can see that their FTEs, their full-time equivalents, are now at 5, and I anticipate that they'll be catching up on those grant expenditures throughout the year. So I don't anticipate that $56K will remain. In the clinical services business unit, IMM immunizations is $131K underspending, but this is due to wrapping up our other business unit of IMM4, and so we'll see those reimbursements increase and even out as the year progresses. So I hope that this gives you a little bit of additional insight into some of the analysis that we do on some of these program-specific grants and how carefully we watch them. I do anticipate that we will receive our revenue from grants that we had planned. Now, as we move down to licenses, fees, and permits, you can see that we're trending a little bit higher for the first quarter. Some of that is due to environmental services, licenses, and fees coming in high. Some of these items are seasonal, so annual renewals happen in that first quarter. So as the year moves on, I believe some of this variance that's showing an increase in revenue will slightly decrease over time. As we look at Medicaid fees and insurance, we are trending a little bit high there, and I do have a follow-up meeting with our Medicaid biller to take a closer look at what's driving this increase. Is it an increase in volume or additional billing? Oh, there went our slide. When we take a look at interest income, I'm pleased to report that we're about $8,000 higher than we had anticipated, and that's a pleasant surprise. So overall, you can see that we have a total revenue variance of $115,000, but I think that you'll see that that $437,000 will catch up as we close out through the year. Now I'd like to move on to expenditures. As you know, last month we reported personnel vacancy savings in the 200,000 range, and so we've continued to add to that this month as we had anticipated. Personnel vacancy savings have increased in March over the previous presentation, and I wanted to mention that with personnel, we are experiencing a slightly higher than anticipated and budgeted benefit cost in healthcare, which I anticipate will be fully covered by personnel vacancy savings. And as you can see, it's not having an impact on our personnel line at this point, as we're trending at $327,000 under budget. So overall, between our revenue and expenditures, you can see that we're well on track for a strong first quarter. I do think that the net impact of $328,000 will turn around as we move through the year to move more towards our budgeted, original adopted budget. So I don't believe that we will finish, $328,000 under. I just wanted to clarify that net impact for you. Are there any questions on first quarter March?
Dr. Vu.
Thank you, Sarah. I meant to ask this for a while, but I haven't want to ask it now. I think I asked this question before one time. Are we billing for Medicare? If yes, can you show the amount? If no, can you say why, please? And then the next question will be for other payers.
We do insurance billing, but as far as the detail amounts of that, I would like to follow up with the board in a response after the meeting if possible. Because I'd like to give you accurate information on the sources of those revenue for Medicaid, Medicare, or other insurance. I don't have those numbers at hand right now, but I'm certain that I can provide it.
Okay, thank you. So it sounds like Medicare, yes, we do bill Medicare for services.
I think I'd like to follow up with our insurance billing team and provide an accurate response after the meeting.
Thank you.
Thank you.
Any other board questions? Sarah, thank you, and thank you for the explanation that you went through this morning. We appreciate that, and looking forward to continued good trends throughout the year. Susan?
Yeah. I did want to make one additional note to put on your radar. As we've been winding down from the pandemic, it's been a few years, and certainly we've seen some staff turnover nationally. Local public health organizations and state health departments are seeing about a 50% turnover with staffing within the last few years. Our agency is no different, and we'll provide more information on that in the future. And that's where we're realizing some of the vacancy savings also that you're seeing in some of the excessive fund balance. So wanted to make you aware that we will be providing more staffing information in the future. Also, as we've been winding down, there are COVID grants that will expire, that will be no longer regarding the American Rescue Plan Act dollars, as well as the state's fiscal year and the federal fiscal year will be happening here in June and October. And what we are hearing is, in part of some of these meetings, that there will be some funding formula changes in some of our grants. And what that means to us is that there's a potential for funding reductions. And so we will be monitoring that very quickly and closely. And we have been also intentional looking at different efficiencies and operational efficiencies. We have been, it's been more than a year where we have been looking at every different position as it relates to if they've vacated, do we need to refill that position? If we do need to refill that position, why do we need to refill that position? Because going through the pandemic, we were heavily structured in ICS, and then we moved a lot of staffing into that incident command structure. So we're coming out of that, and so we're trying to rebuild our organization in a sense, as we evolve, for the here and now, but then also the future. But I did want you to know that funding formulas, some of them are going to change, and some of the funding, there might be some reductions, and we will be monitoring that closely and let you know. When there's not a population-based funding formula, our county does not have an advantage. And so funding formulas, they take many different components, as you know, into that, but I did want to put that on your radar for future.
Thank you, Susan. And as Susan and I have spoken offline, what I've asked on behalf of the board is that when those funding reductions take place, just let us know as soon as they happen, so that we can kind of anticipate that as we're getting toward the end of the fiscal year. All right, thank you, Sarah, thank you.
Thank you.
Okay, and that takes us into the director's report.
Okay, we are going to continue the theme of healthy children and families with the Child Abuse Prevention Month. And so I'm going to call up our maternal child health team to the podium. And we have also a special guest with us, Dr. Jennifer Schulte, who is a representative of District 11 School. And if you could go ahead and introduce yourselves as you are presenting. And we have a presentation that will highlight some of the work that we're doing in maternal child health, continuing with the child abuse prevention theme, and what is our role with MCH within that effort.
All right. Thank you all so much. Good morning. My name is Jennifer Mussaw. I am the program manager for the Maternal Child Health Program, otherwise known as MCH. I'm so excited to be presenting to you all today and really just sharing about the work that we're doing in our program. I am joined by other MCH staff behind me who are going to introduce themselves later on in the presentation, but I want to first provide a little bit of overview of our program to kick us off. So funding for the Maternal Child Health Services was started back in 1935 as part of the Social Security Act and became known as Title V. So Title V was converted into a block grant in 1981, in which El Paso County Public Health first started receiving these funds. So Title V remains the only federal program that focuses solely on improving the health of women and children. And since 1935, this funding has allowed communities to make significant contributions to the maternal child health program. All right, so the overarching goal of Title V Maternal Child Health Services Block Grant is to improve the health of women, children, and youth. Our agency receives $615,272 each year to help us achieve this goal, but we have received level funding for the last several years. So it is imperative that we work collaboratively with our community to address the needs by providing education and, most importantly, how we engage with families this program is meant to serve. So these funds are meant to provide gap-filling services, meaning we work in an area until it is no longer needed, or the needs are being met elsewhere. And so our program continuously evaluates and adapts based on those community needs. Our services are completely free to the community, and our team is made up of wonderful experts in their field, whether that be our nursing staff who were celebrated today. We also have social workers on our team as well as former educators, and we all bring significant perspective to the work. So today, Title V gives states the flexibility to identify approaches to improve the health and well-being of the MCH populations. This approach allows us to be adaptable and responsive to our state and local needs. CDPHE completes a needs assessment every 5 years, the last being in 2019. And based on this, they create priority areas that guide our work. So for this current cycle, our agency focuses on improving access to care, where we help families navigate resources for their child, and focus on the efforts for improving and supporting healthy childhood development. So our team prioritizes our relationship with CDPHE as well, and we take advantage of every opportunity to ensure that our community is represented in decisions made at the state level, and that our feedback is utilized to help influence the maternal child health work. So we have participated in numerous projects with CDPHE that are then implemented throughout the state. So for example, MCH staff participated in the creation of a community needs assessment tool, and then we utilize that tool in our own county to help us then guide the direction of our future work here. So we have done such amazing work through the priority areas over the last several years, specifically in the relationships that we build with the caregivers that we serve and with the organizations that serve youth, which we will hear more about in the coming slides. So I'm excited to hand it over to Laura and Diana. They're going to introduce themselves and they're going to share a little bit about our work under Improve Access to Care.
Thank you, Jennifer. Hello, my name is Laura. I am one of the nurses on the maternal child health team and have been employed at El Paso County Public Health for almost 6 years.
Hello. Hello, my name is Diana, and I am one of the nurses on the maternal child health team and have been employed at El Paso County Public Health since the last year. Most of my nursing experience has been in outpatient pediatrics and being in home and clinic settings.
So the focus of work being done through maternal child health has shifted over time as the needs of our community grow and change. Our staff constantly evaluates our work and talks with the community to ensure the needs of children are being addressed. The maternal child health program is committed to supporting healthy child development and improving the well-being of all children in our community. However, every child is different, and sometimes children do not reach certain milestones, which may signal a medical or developmental problem requiring special attention. These children may require extra services to ensure they are growing and developing. That is where we come in, to provide information and education to caregivers and community members. My colleague Diana and myself are both nurses and understand the complexities these children often face and have expertise on services and resources for this population. Two areas of our work that I would like to highlight for you today are the Community Voice Collaborative and our resource navigation. We are continually looking at innovative ways to reach a larger percentage of children with special health care needs and implementing activities to address unmet needs, barriers, and gaps. So we created the Community Voice Collaborative, which provides an opportunity for maternal child health to engage with the community to better understand problems, brainstorm solutions, and hear stories from those most impacted by our work. Community members provide unique insight, a diversity of perspectives, and we understand that there is valuable untapped expertise from those with lived experience. The meetings provide a space for caregivers, community partners serving children with special health care needs, and really anyone in the community to have a space to come together for in-depth and thoughtful conversations. The meetings are community-focused and bring people together who are aligned behind a common purpose. They offer opportunities for meaningful connection, sharing of knowledge, and talking about experiences. We cannot do this work alone and depend on our community partners. We are continually meeting with agencies regarding the services they provide and having discussions to help us gain a better understanding of the issues that the families they are working with encounter. On this slide, we wanted to highlight the variety of agencies that we partner with so we can better support our community. Next, Title V funds can be used in a variety of ways that best supports the unique and varied needs of children who require extra support and services. One way we support these children is through resource navigation, which is provided at no cost to families. Also, there are no eligibility requirements related to income or diagnosis. Providing information resources for children needing extra services is a core public health priority and a requirement for programs that receive Title V funding. Staff help families overcome barriers to accessing necessary services and link families to resources which are outlined on this slide. Through our work, we want to equip and empower families to feel confident coordinating their child's care, navigating health systems, and advocating for themselves and their child. We take extreme care with every family that we work with, knowing that we can't understand the barriers they are facing, the fight that goes into accessing care, and the importance of services. Each family receives our devoted attention during every encounter, and the resources provided are individualized to the needs identified by the caregiver. The support we provide may seem simple and inconsequential. However, it could mean everything to the family we're working with. There is a person behind every story that we hear and every family that we work with. So I'd like to share a story with you about one family help through our program. We have permission from the family to share this inspiring story, but to protect their privacy, no names will be used. This picture is just one of the many children that we help every year. I received a call from his grandma, who had just been given guardianship. He had no services in place. His grandma said she was very overwhelmed and had no idea what was needed for a child like him. I listened to her many concerns and talked through the different options for services and equipment that may benefit the child's growth, development, and quality of life. His grandma said without support, she would have struggled to get everything set up. She appreciated the monthly calls, information for testing, and suggestions. His grandma said the support was invaluable and a lifeline for her. She stated that the work being done through maternal child health is very important. I worked with this family for about 6 months, providing frequent follow-up calls and helping overcome the obstacles and barriers to getting services set up. Before closing the referral, I made sure the grandma understood the different services, was connected with providers, and felt confident directing care for her grandson. This week, a year after working with this family, I received a text from her stating, "Hi, my old friend. I wanted to let you know that we officially adopted our grandson yesterday." In an ideal world, parents would be the trusted adults for their child. However, we don't live in an ideal world. In this case, his parents were not able to provide a safe place and the care that he needed. So his grandparents selflessly stepped into the role of trusted adults. Because of their love, care, and attention to his needs, this child is thriving and growing into a remarkable young man with endless potential. As you can hear from this story, and the many others that we could share, we are more than just a program to the families we work with. It is stories like this and a passion for helping others that gives purpose and meaning to our work. We appreciate you taking time out of your very busy schedules to learn about the wonderful work being done. I will now transition over to Paula, who is going to share about her work to support healthy child development. Thank you.
Good morning. My name is Paula Hergert, and I am a prevention and policy specialist here at El Paso County Public Health. But I also want you to know that my first career was as a public educator. I taught for 35 years. The topic that I taught to children was actually health and physical education. So I want to tell you a little bit about the importance of coming to this job with an education background and the passion that I had for the work that I did while I was a teacher. So I'm going to kind of share the journey as we go. So when I retired from teaching, and I remember taking this position, it was called community health educator at the time, and I thought this is a great fit. Because the idea with this position was to work upstream to decrease bullying and suicide in our community. And if any of you lived here in the early 1990s, I was going to say 1900s. You're amazing if you lived that long, so you should be ahead of public health. We had such a high rate of teen suicide, death by suicide in our county and in our city that we actually made Newsweek. And there was a huge article, and at that time, it wasn't because of the Newsweek article, but public health said, what can we do upstream so that when kids become middle schoolers and high schoolers, and sadly, we've had death by suicide with much younger kids, but what could we do earlier so that that isn't a box that our youth decide to check when they're overwhelmed. So, hence my journey to where I am today. When I took over this role, my predecessor said, Paula, have you ever heard about adverse childhood experience? And it is a study that you can look up. It started in the 1990s, the Adverse Childhood Experience Study. And what they found in researching 17,700 adults was that there was a correlation between adversity they faced, and there's 10 specific types of adversity they used for the study, not saying that they're the only types of adversity children face. But there was a correlation between adversity in the childhood years to negative outcomes as adults. One of those was an extremely high chance for adults to have suicide ideation, high rates of depression, and anxiety. So I'm like, this is the true upstream work. So I continued my research, and I ended up, beside being a public educator, I'm now a certified peaceful household master trainer. I don't know if any of you knew Kathy Orr. She was the first city trauma guru that did a lot of this work. And then while I'm on this journey, I met Dr. Jennifer Schulte from D11. And if you believe in fate, or we were in the same district for years and our paths never crossed. And she said, would El Paso County Public Health allow you to go on this journey with me? And through that relationship and that journey, we both became certified trainers in what's called the neurosequential model in education. Neurosequential is kind of a weird term. It's not, if you type it in, it shows red because it's coined by Dr. Bruce Perry. It just means we need to understand how the brain develops, grows, and changes. And we also need to, when we're working with children, remember that anything we do has to have a relationally rich component. So that's where I got here today. Through this training and with the blessing, thank you, Susan and Deanne, now we are working with, we heard that kids struggle in families. We heard the statistic from Kid Power. 1 in 10 children are sexually abused. That's one type of abuse. That's one type of adversity. And Kid Power is one organization. So what El Paso County Public Health, MCH, has allowed us to do, especially with our partners, what can we do upstream to increase capacity, to try to mitigate and hopefully eventually prevent adversity that we know has this lifelong impact on health and wellness. So as you can see, we believe in this statement to the core. And it's by Dr. Bruce Perry, who I got my training from, Jennifer and I got from. If you are interested, he just wrote a book with Oprah Winfrey called What Happened to You. That book will help you understand completely what we're doing in your community. It says, relationships matter. The currency for systemic change is trust, and trust comes through forming healthy relationships. People, not programs, change people. And we know majority of the adversity happens in relationship, and it's within relationship that those children can heal, and we can create new neural pathways for them to have a different template of life and relationships. And I forget who said it, but we love the one quote. Every kid is one trusted adult away from being a success. So if that trusted adult doesn't by chance live in the same house with the child, we want every adult in our community, and I know that's lofty, but every other adult that touches the lives of these children, we want them to be able to provide a safe, predictable relationship where children can not just survive, but thrive. Here are some of the goals, and like I said, they're lofty. But just like the Adverse Childhood Experience study, you can look up another study now, and it's called Healthy Outcomes from Positive Experiences. And now they have proven a correlation between if people have positive experiences, especially in their relationships, they far outweigh adversity. And that is our goal as a community, to provide those things for our children. So here are some of our lofty goals. We want to provide opportunities for all children to have safe, nurturing, and supportive adults in their lives. One of you went to Forge Evolution, and if you hear people's story, how one or two people can change the trajectory of a child's life, if we can do this for them. We want to provide opportunities for all children to live, develop, play, and learn in safe, stable, and protective environments. This is where our partners with all the school districts come in, and Jennifer will address. We want all children to have the opportunity to feel and know that they are loved, they are valued, and that they not only belong, but matter to the community. Our little humans matter to this community. And I'm sorry if I get emotional, but they do. They are us in a few years. We also want children to develop the skills that will help them succeed. And we also want them to be able to forge a sense of optimism for their future, where they can thrive. Good goals? Lofty goals? Yes. I'm going to be working till I'm 90. I'm just saying. This slide just shows a few of the organizations that, in my role, I've had the opportunity and the honor to interact with. So this started out where we were working mostly in schools, but what we really need to think about, the true upstream work, is working with parents while they're pregnant or before they're pregnant, because we know that maternal distress is already changing how the brain develops. Trauma and stress in adults change how we think. When a child is developing, it changes how their brain grows. So as you can see, we're starting in schools. That's intervention. Our hope is to eventually work. As public health, we're all about prevention. What can we do to prevent this type of environment or situations to be happening in families in our community? Just this year, in 4.5 years, I think, alone, I've trained over 2,000 people, and Dr. Schulte will share how, I think I added it up with Indy 11, it's, yeah, just under 2,000. So, and here are a few comments that we've gotten. This class was fascinating. It is fascinating if you've never researched brain development, and applicable to my work. Thank you for the opportunity to participate. Very informative. I think everyone in our school district should have this training. An excellent training. Thank you for offering it at no cost. So thank you, El Paso County Public Health, that you are providing a service to your community members. And we know schools don't have a lot of money hanging around. So it's a really nice service for them. So we know the MCH work is rooted in partnerships and relationships, and they're highly valued. The work of improving health is most successful when we combine resources and perspectives to support children and families. So at this time, Jennifer and I had the opportunity to present to their Board of Education about a month ago. And I'll let Jennifer, we're going to be training some leadership, and we hope at some point to train the Board of Education, which we'd be happy to, if you all want to go through our training, we'd be happy to provide it to you as well. But you won't get to sit the whole time. So I'm going to hand this over to Jennifer.
Thank you, Paula. So good morning to all of you. It's really wonderful to be here with all of you and really appreciate this opportunity to speak to this partnership that we have developed. And I was telling Paula, I can't believe that it was actually 5 years ago. I said, where did the time go? And as we know, it just goes like that. So, but it's really good work, and we are creating a better community because of the partnerships that we have with El Paso County Public Health. And so I just want to speak to you all about the benefits that I see as having a partner with El Paso County Public Health, not only with Paula, but these wonderful ladies as well. This partnership has enabled us to intentionally offer professional learning to our adults within our system. And as Paula said, we also are going to have the opportunity to train our district academic leadership team. And our goal is to train everybody within District 11 so that they understand how important relationships are, and also how important it is to understand brain development. So it's not only the staff that we're training, but we want to train parents, we want to train students, so that it's really far-reaching, and we're creating a common language that everyone can understand. We've also been able to create a sustainable and ongoing approach to enhance the learning of our adults. I mean, this 5 years seems like it's just happened in a year's time. And we are so excited to continue this partnership for many, many years to come. We've also been able to increase our collaboration across our entire community. So Paula has introduced me to several folks from other school districts, which provides us the opportunity to be thought partners with one another so that we're not reinventing the wheel, but instead we are sharing ideas with each other so that we can most effectively meet the needs of our students within our community. Not only have we been working together to train staff, but we've also have the opportunity for El Paso County Public Health to participate in some of the other things that we have going on in District 11. A couple, just to name a few, Family School and Community Partnership. We know Family School can do part of the work, but we need that extension of community as well, because then we are truly creating a better community by all of us working together. So District 11, we truly appreciate the human capital that you all provide us in District 11, because I alone cannot do the work. It really does take everybody working together to make a difference. And so thank you for the opportunity to speak with you about the benefits that, as I see it. And I just want to leave you with a thank you note that we received from our Director of Early Childhood. And she said, "Sending a heartfelt thank you for the amazing support you provided to our preschool staff this month. I heard over and over that the time spent with you was valuable and meaningful. Staff came down buzzing with conversation about how they can get new practices set firmly into routines and how to be sure their new learning doesn't get washed away by old habits. That says it all. Between reviewing the slides and hearing from my coordinators, I can say with total confidence that you met the staff right where they are this year and gave them perspective they needed now more than ever. I hope we can continue this work next year. Without a doubt, the energy you spent on this PD provided an immediate and positive impact on our preschool teams and on our students. So thank you."
All right, so that concludes our presentation today. I did just want to note that these are some of our MCH staff, but we do have other MCH staff who are not standing up here today. So I just want to say thank you to everyone for their hard work and take any questions.
Do we have any board questions or comments? I don't see any. I've got a couple that I want to make. First of all, to Laura, don't ever make me cry in public again. But to Paula, something that you said when you showed the slide of goals and you called them lofty goals, I want to thank my mom and dad, because they weren't lofty goals to them. That's just how they raised a kid back then. And we try to do the same thing with my children and grandchildren, and just by loving them, giving them support, showing them options, and letting them know that they're important and valued. So I appreciate what you said, but really wish they weren't lofty goals. I wish they were just something that everybody had top of mind. And then, Jennifer, you said, when you read the letter, you said that the training met the staff right where they are. I think that's the goal of all education, isn't it? Meet the student where they are so that they can understand, accept, and put into practice the information that has been given to them. So I appreciate everything that all of you do. We are very grateful. Our kids are our future. You know, they are us in a few years, and we're very grateful for the work that you do to ensure a positive future for the little ones in our lives. So thank you very much. Susan?
A couple more things on my director's report, but I just wanted to say thank you. And I believe that the school district, District 11 School Board also recently did a recognition of El Paso County Public Health, and specifically for the work, and I think that that's commendable as well. It just shows that you all are demonstrating such great public health work, and it is making a difference, and we can certainly see the passion and feel that when you're speaking. And so we're very grateful to the work that you all do, and thank you so much for being here, Dr. Schulte. Really appreciate it.
Well, thank you. We appreciate it.
Let us know when you want to be trained.
Okay.
Will do. Is Dr. Bernadette Albanese? Oh, hi. Could you come up? So a couple of hot topics I think that I would just like to bring to your attention. You're hearing a lot about avian flu in the news, and so I would like to just give a brief update on that. And then if we have time also, Doris, you had mentioned that the safe injection site, that legislation has got killed, but also there recently was some legislation that passed regarding syphilis screening, and you all are aware that we do work around syphilis and have a strong partnership with the sheriff's office and how we're screening. And so I would like you to provide an update on that, if you could, please.
Sure. Is this on? Yeah. Good morning, Dr. Bernadette Albanese, co-medical director here at the Health Department. Avian flu. So there has been an outbreak of highly pathogenic avian influenza. We call it HPAI because we love acronyms. It means bad bird flu. That has been present across the United States in migratory birds and then passed to poultry flocks all over the country, including Colorado. This has been going on for a couple of years now. You've probably read about it. In birds, the disease is sort of highly fatal, like you get sort of die-offs, and it's easily spread to other birds, and so affected poultry flocks have needed to be culled to try to keep things safe. There's been very rare, thankfully very rare spread to people, but on occasion that can happen if someone really heavily interacts with an infected bird. And so that's sort of become almost background now. I mean, the Colorado Department of Agriculture spends actually a huge amount of effort on their end. And when we have, on the human side, if there is someone who develops a flu-like illness, that works with potentially infected birds, and they get evaluated, and that's where the work has been. That's less of a story now as compared to less of a story than what's happening now. So since March, the end of March, there have been bad bird flu, this particular one called H5N1, that's just a strain of bird flu that has been identified in dairy cattle. That's a problem because we are, A, it's a mammal, and B, it gets a little bit closer to people in terms of our risk. So right now, there have been infected dairy cattle identified in 8 states, began in Texas and Kansas, but now has been identified in New Mexico, Idaho, South Dakota, Michigan, Ohio, and North Carolina. You'll notice that 3 of those states are very close to us. So it's a problem. And so there is a tremendous amount of work. I mean, this is fresh. We're just a month in, right? So there's a tremendous amount of work going on with U.S. Department of Agriculture, all state health departments, state departments of agriculture that oversee farm animal stuff, in states, as well as the Food and Drug Administration, because milk is regulated by the FDA. And this virus is found in their milk, which is a problem because we drink and use a lot of milk and milk products in the United States, obviously. So, so at the moment, so there's herds, various herds in those 8 states have been identified. The world of animal health are sort of trying to wrap their heads around what's going on and why it's getting, so it still originated in birds, it just made it into a mammal and into a cow. And the scary part about that is a couple of things. One is influenza viruses, they begin in birds and then they go to other species. Our influenza viruses started out as birds way back when, that are seasonal influenza viruses, right? And the virus likes to mutate a lot. And it replicates a lot once it's in an infected animal. And it can mutate to like to replicate more in mammals. That's the concern, that it would hop into a mammal, mutate and saying, I've gotten efficient at replicating a mammal, and then eventually one of those mammals is people. And it becomes the potential for another, it could become a potential for another flu virus that causes severe illness in people, and that's all what we're trying to avoid. The second problem is that it's in milk. And pasteurization is what we do. So it is not, so raw milk is not clean. It's not, it can't be. It comes out of a cow in an environment on a farm with soil and stool and everything else. It is not, it doesn't come out. Once it exits the animal, it gets exposed to pathogens on the animal, on the udder, in the environment. And so we pasteurize our milk to remove pathogens, and the common ones, E. coli, salmonella, Campylobacter, lots of things that cause foodborne illnesses. And you can add to the list that HPAI, so bird flu. And so pasteurization is critical to protect our milk supply, and it's exactly what the FDA, and I've been on national calls about this for the past month, they're like, we believe in pasteurization and we do not, you know, raw milk is a problem and it's a potential health hazard. We've been saying that message all along. We are double downing and triple downing on that message. Use pasteurized milk. And so we'll see. The story is just evolving. Right now, Colorado is not on this list, which is good. I actually have some questions out to the Colorado Department of Agriculture about some of the steps behind the scenes that they may be taking. I can bring that information back when I hear back from them. But the alert is very, very heightened. There's a lot of attention being paid to this right now. It will continue to be in the news. If you read the news in any of these affected states, you will see and hear about it. So I'll pause there for a second and see if there are questions. Commissioner Brenner, it looks like you had.
Actually, you answered it.
Okay.
It was whether the pasteurization process took care of it for humans.
That's what the science says now, but there's lots and lots of testing going on to make sure that that remains the case. That, you know, you can only imagine that that would be a severe problem if there was something about pasteurization that didn't work, but it's expected to because it takes care of all of the other pathogens as well. And so our milk supply for nearly 100 years has been safe because of pasteurization, and that's, if you drink pasteurized milk, that's where we're at right now. Dr. Vu?
Thank you. I don't know the answer to this, but I'm assuming yes. But would you know if the seasonal influenza vaccine have some coverage against the bird flu?
It does not. That's a great question. It does not. However, if there's one thing we know how to do pretty well in our country is make flu vaccine, because we have to make it every year. And so there are lots and lots of manufacturers involved with that process. It's a very standardized, it's coordinated internationally with the World Health Organization. For our hemisphere, the Northern Hemisphere, every February, the CDC and the FDA and the WHO pick the strains that we include in the influenza vaccine for the coming fall. So it's already in production, right? And CDC, these viruses from sort of a bacteriologic standpoint, a microbacteriologic standpoint, they are relatively straightforward to work with. So CDC already has a candidate virus for a vaccine that's in production for bad bird flu, the H5N1, that's circulating now. So So there's already that work going on behind the scenes as a just in case, because what happens is the CDC gives manufacturers a sample of the virus to use to make their vaccines the following season. And so as long as CDC tries to keep that stock, and so they are working with the H5N1 virus now as a candidate virus for human vaccine if necessary, which is good news.
Thank you. Would you think there might be some cross coverage between a vaccine against H1N1 versus
The H5 is different enough. So there is, and there wouldn't be enough for us to feel like it reliably could protect someone. So by the way, so getting back to the cattle situation, so there has been one individual, a farm worker in Texas, that got sick with this virus, but their only illness was conjunctivitis, so basically pink eye, which everybody's scratching their head about as well, because bad bird flu typically causes bad pneumonia, because bad influenza typically causes bad pneumonia, whichever the type of strain it is. So that individual has been of great interest. It has, in terms of the cattle situation, has been the only farm worker to date since March to have identified to be infected with this.
May I ask a question?
Please.
Thank you. I think of influenza as a respiratory illness.
Mm-hmm.
Can you help me understand transmission through milk?
I'd love to answer that question if we knew. So the cattle, the cattle that have, some cattle are asymptomatic and they're just identifying it in milk. Some cattle will have lethargy, and I'm not a veterinarian, so I'll try my best. Lethargy, fever, decreased milk production, discoloration of the milk. So that's sort of where, you know what I mean? So if you sort of have a sick cow, they're not developing pneumonia, right? And so the farmers are like, your milk looks weird, right? Or you're not producing as much. And so that has prompted some of the testing. And so they're still trying to figure it out. It's ranged from cross-contamination in the environment. I don't know if any of you have ever been, some of our environmental health folks are here, they might have been on a place where they do milking, right? It can be a big fancy production and a big, sort of manufacturing kind of thing for them. Or it could just be, you're putting a vacuum on an udder and then you move it to the next animal. And, again, outside of the cattle, the environment is heavily contaminated because it's just what it is. It's a farm animal, right? And so it's extremely difficult to try to keep that sterile. There's no such thing. And so inherently, once the milk leaves the animal, it's going to get contaminated in the environment until it goes through a pasteurization process.
So, but if there's virus in the milk, what I'm trying to understand, what is the risk then of passing it on to a human who consumes the milk without any contact with the cow?
Well, the concern is that you drink it,
right,
and that's your exposure.
Right. So, and I'm sorry, but as a layperson, if it's a respiratory illness, how does going through my digestive tract?
Yeah,
put me at
I think
risk?
I think that's exactly what we're trying to figure out. I mean, I don't think we want this to be. Go
How
ahead.
does it, isn't pasteurization kill the virus? That's
Yes.
what I'm thinking.
Yeah.
So
Once it
if
gets to your-
Pasteurization kills the virus, how is it passed?
If you didn't drink pasteurized milk, right? I'm sorry. Thank you. If you drank raw milk, or the raw milk was continuing to contaminate other things in the other parts of production. So once for example, if it came out of pasteurization and then there was an opportunity for that newly pasteurized milk to get recontaminated before it went into containers, which then end up in our grocery stores, that would be an issue. So there's a lot of steps in place in terms of finishing the pasteurization process and then ensuring there isn't opportunity for new contamination between the end of pasteurization and point of sale. So we're trying to figure this out. We're trying to figure this out. Right now, public health's stance on raw milk has been this way forever. Don't drink it, and don't eat raw milk products like cheeses from raw milk, and then until we can kind of figure this out. But in terms of even how it gets from cow to cow, is trying to be sorted out as well.
So breathing the milk near the raw milk, it's airborne at that point.
This is just not clear yet. The risk to humans. I mean, you could, as a farm worker, you could be working with an infected cow and rub your eye, You have milk on your hands and rub your eye. That's going to be an introduction through the membranes of your nose, eyes, or mouth. That's typically actually how flu gets spread anyway. So just the cross-contamination right now is a big issue. But we'll see. This is an evolving story. This is not going away. We'll see if and when cows get impacted. Hopefully not. But there's just a lot of activity right now. And then, Susan, did you want me to, was there other questions?
Dr. Albanese,
Oh, yes.
thank you, and please excuse me, I've got running out on you to get a dentist appointment done.
Sure.
So apologize for that, but Doris will close out the meeting. The rest of the board members, thank you very much, and we'll see you all. I won't be here next month because of vacation, but I'll be back after that. Take care.
And Director Whelan, you want me to talk about the syphilis bill? So House Bill 241456 addresses syphilis screening in pregnancy. It was actually introduced into the House Health and Human Services Committee yesterday. I was there testifying actually on behalf of my other job with Adams County, as one of our representatives was part and parcel to writing this bill. And it did pass out of committee, thankfully. So the bottom line is, right now in state statute, CRS 254201, screening for syphilis and HIV during pregnancy is defined in statute. And it was defined in statute because, quite honestly, providers need a reminder to make sure that they do this on pregnant persons. So it defines it as screening once in pregnancy for syphilis standpoint, once in pregnancy on first trimester, or entry into prenatal care. And I don't think it's news to this group that syphilis rates in Colorado, in El Paso County, and Adams County, particularly the I-25 corridor, our populated corridor, have gone through the roof over the past several years. This is happening in a lot of jurisdictions around the country. It's a complicated problem. But what's happened concomitantly with that is that we are having way more cases of congenital syphilis. So congenital syphilis is when a fetus is infected in utero because the mother is infected as well, and it passes through the placenta to the baby, and babies are born, most of the time born sick, very sick in some circumstances, and this is an entirely preventable infection. Syphilis is treated with penicillin. It's a shot of penicillin, so it's a little more complicated than just taking an oral pill, but it's very, very treatable. And so our cases of congenital syphilis in Colorado have gone up 900% since 2017. So far in 2024, we've already had at least 7 deaths, whether by stillbirth or fetal death. So it's bad for babies. And so it's a complex process to so what's happened is the rates of syphilis in women of reproductive age, which from public health statistical purposes is defined as someone 15 to 44 years of age who can get pregnant, have also gone through the roof. And eventually something breaks. If you have more syphilis in people who can be pregnant and they get pregnant either after their syphilis infection, before their syphilis infection, if they're already pregnant and then get infected during pregnancy, whatever it is, if that individual is not screened, diagnosed, brought into care, and treated, then the fetus and the baby are at risk. It's very that's very straightforward, and it's a bad outcome for the mother, and it's a bad outcome for the baby. And so the goal here was, the original intent of the bill was to make the baseline requirements for syphilis testing during pregnancy more frequent. First trimester as before, third trimester to try to pick up people who fell through the cracks before, pick up people who didn't get adequately treated and still aren't cured, and pick up people who maybe were negative before but got reinfected later. And then to test again at delivery so that the pediatricians, the handoff, they have fresh information so they know what to do with that baby. And I'm a pediatric infectious disease physician. I've treated babies with congenital syphilis in my practice from years back. And so that was the original intent of the bill. CDPHE, with the 2024 data being just shocking and horrible for congenital syphilis cases, last week released a public health order to mandate screening in first trimester, third trimester, and at delivery. So in part, not to keep waiting. I think this was long overdue. And so part and parcel to their public health order, the bill was changed to basically take pregnancy syphilis screening out of statute and giving it to the State Board of Health, and having them put it in rule. It would still be a mandate because State Board of Health rules are still laws, but at least there'd be more flexibility and pliability to sort of dial things up and dial things back, depending on the course, really in a syphilis epidemic right now, depending on the course of the epidemic. If, I think that, from my professional perspective, this needs to be in place, like we're talking year or years for this to turn around. But if and when it does, which the goal is for this to turn around, then they can dial it back and they can do it simply without legislative action. So that was the discussion yesterday at hearing. It did pass out of committee. It will go to the House floor and then the Senate, and there are Senate sponsors and so forth. So it's a good thing. It's a good thing that we have more screening. It's a good thing. And then our reproductive health clinic, thankfully, is working with the jail to help with screening and early treatment. They're able to treat pregnant people, which is fantastic. And so our clinic is already getting more and more involved in trying to address the syphilis epidemic in our county.
Yeah, thank you, Dr. Albanese. I'd like Summer South to come up because I do think that what we're doing with our sheriff's office is innovative and proactive as it relates to trying to do all that we can. So Summer, if you want to say a few words of what we were doing, just to kind of refresh memories.
Absolutely. Thank you. So again, Clinical Services Division Director, last year, you all helped to approve a grant that we received from CDPHE to address the rising rates of congenital syphilis. And so what this has enabled us to do is to hire an RN to get into the jails and to test women of reproductive age for syphilis. We test for other things as well because we know syphilis lives with other STIs. But especially in pregnancy, trying to reduce those rates of congenital syphilis is of paramount importance. So fortunately, the timing, I don't want to say fortunately because none of this is fortunate, right? But that grant enabled us to partner with the jail, with EPSO, so that they are now poised to follow along with this public health order. There is no major upset to their operations. And they are not taking on any additional cost occurrence due to the fact that we are already in the jails, have a presence there, and are already testing women with syphilis. And when it comes to that first trimester, third trimester, postnatal, we don't, post-delivery, that is not something that in the jails that we can touch. But at least that first and third trimester screening, they're already doing it. We're already doing it. So everything in that partnership is in alignment with these efforts, these continued efforts to reduce these rates of congenital syphilis. And in fact, this contract will be coming up for renewal here pretty soon, and we're really excited to continue this work and to expand to hopefully see some decreases in those rates.
Questions? Do you know how many have been tested at the jail? How many women have been tested? How many positives of syphilis? How many tested positive?
Yeah, so as of right now, so we were actually able to get into the jail as of December of this
Not
past.
a lot of people are trying to get into jail, but that's good.
We were trying really hard and we got there. We were pretty impressed. We're not letting her out. So we got in finally and started testing December of this past year. And up until this point, we've tested over 160 women of reproductive age, and we have an 18% positivity rate for syphilis alone, as well as pregnant women with syphilis.
How many pregnant women were tested? Do you know? Now I'm getting into the weeds, but.
Right. So I don't have the total number of pregnant women tested. I will get those numbers to you easily. But I will tell you that as of right now, there are 4 that we've tested positive for pregnancy, positive for syphilis, that we are taking care of.
Okay.
Yep.
But there were other pregnant women tested who didn't,
Correct.
weren't positive?
That is correct.
18% in jail. What's the percentage in the county for those that, say, public health tests? Do we know? Do you know?
You know.
Is it close? Is it?
I don't have that. I mean, from a county perspective, in terms of all providers, we don't have the denominator necessarily of like how many we tested. We just have the positives.
Uh-huh.
So you got in reproductive health clinic, you may know how many that you test just specifically out of your clinic, but not. But we also have to be careful about confidentiality.
Sure.
So.
What is it in Colorado? I'm just trying to figure out, is 18% 3 times higher, or is it?
I don't think that data is available again because there's no tracking of how many tests are sent. It's just reporting of the positives. And once you're infected with syphilis, so there's a couple of different tests there's 2 different tests that are used to establish a diagnosis of syphilis. And then once you're tested and treated, one of those tests is repeated because your numbers go down. And so that's part of the test of cure. And so it'd be a little hard, it'd be a little confusing because some of those syphilis tests are for people getting repeat testing and so forth. So there's not really a direct way to answer your question.
When I was doing PA work, though, we kind of had a number, of males in Colorado. I don't remember any of the numbers, but, 3% are likely to have gonorrhea, whatever it is. We don't.
Yeah, I mean,
know
what
that?
we do is we have rates, so we can
Yeah.
do rates per population. We have a handout. We'll show you with the latest handout.
Okay.
I didn't bring those numbers right with me. So there's a rate per population. So it'd be a rate per 100,000 males, a rate per 100,000 females, a rate per 100,000 population
yep.
by age group and so forth. So we do have that data. We can share a handout with you
That's kind of
after.
what I was curious about. And then if I know I'm kind of going crazy here, but one final question. The 900% increase, that's pretty good.
it's not good.
What is, that's pretty awful. That's what I meant
It's
by
terrible.
good.
Yeah.
What's the explanation? I know there's more than one, but what's the general reason for that? And that was since when?
2017.
So in
So between
7 years?
2017, so between 2017 and 2023, it went up 900%. So basically, we used to have, Colorado's baseline was single digits, right? This is supposed to be a rare disease. Congenital syphilis is supposed to be very uncommon. So we'd have 5 or 6 or 7. Then it went to, I think, 15, 22, 30s. In 2023, it went to 50. So between 2022 and 2023, it went to 50. And in 2024, the first quarter, we've had 25, which slates us to be over 100 by the end of the year. And more fetal deaths. Hence public health order, hence the legislation. So it's a disaster.
But, the whole thing with public health is, hey, we try to figure out why is this happening, and then we address it.
Exactly.
Why is it happening?
So it's happening because women of reproductive age have higher syphilis rates, and people get pregnant, and then it's a breakdown in the system to find infected pregnant people and treat them. So no prenatal care, late prenatal care didn't get tested. Prenatal care got tested, didn't get treated. Prenatal care got tested, inadequate treatment. It's a whole, all of those reasons.
Mm-hmm.
And so the goal here is to put syphilis back on the map. It used to just be an STI, quiet, rare. It's not. Put it back on the map, change systems of care for people who are pregnant. So it's right there. I know I have to test for syphilis for you, and I know I need to do it multiple times in pregnancy. Get providers more on board about standard diagnosis of syphilis and treatment. Help them be educated and help them get access to injection penicillin, which is not something they necessarily keep in their practices, right? And so forth. So this is a all hands on deck healthcare system, correctional system, emergency department system that finally for our state is being moved forward hopefully as a unit, now that this order is here and out, to sort of change the way that the care is being delivered, and try to help people not fall through the cracks.
One final question. So I'm trying to get at this. We've had 8 to 10 million migrants, whatever you want to call them, come across the border, essentially zero medical screening when they cross the border. Those are childbearing age men and women. It would make sense, there's 40,000 of them in Denver or more. It would make sense to me that that contributes to what we're seeing, and not just with this disease, but with others, because they just haven't had the medical care in the places they're coming from. They show up here, some are already pregnant, some become pregnant here. They haven't had our standard of medical care. Do you know, is that contributing to this?
This issue has been homegrown in Colorado for the past 5 years, prior to any newcomer issue.
Well, I would say we've had that issue going on for years. So this
issue is not being driven by newcomers. It's being driven by people who are already here in Colorado, and it's around challenges in accessing care, right? These are issues about access to care, about education, about risk of syphilis, about providers being consistent with recommendations, providers' familiarity with syphilis. So it's a very, very complex problem. It is absolutely not just one thing.
And I don't think it is one thing.
The issues around why congenital syphilis occurs when these cases are reviewed, and they're reviewed by the states or reviewed by CDC, actually hasn't changed in years. It's the same reasons. It's just amplified now because syphilis has just become more common across the board in our populations.
And that's maybe we can talk about this more, but why is that common? Why has it become more common? Why is syphilis more common? That's the root.
Syphilis is a sexually transmitted disease.
Okay, but why is it more common now? And I don't want to keep beating this horse, so thank you for the information.
Any other questions for Dr. Albanese or Summer?
Doris, I don't have a question, but I just wanted to say that, he'd rather leave us here to go to sit in a dentist's chair.
Nobody wants to talk about syphilis.
Susan, any other? I want to thank you both for your informative presentations today, and I also want to thank all the El Paso County Public Health staff for the excellent work that they do, and especially the IT staff. I know that a lot of times we don't recognize them, but they're really important to our meetings as well. So thank you to the IT staff. Can I get a motion to adjourn?
Make a motion to adjourn.
Second?
Second.